Welcome back. Our next guest is pretty much a household name. Kenneth Cole is an American designer, social activist, and visionary who believes that business and philanthropy are interdependent. His global company, Kenneth Cole Productions, creates modern, versatile, functional footwear, clothing, and accessories. And for more than 35 years, Kenneth Cole has leveraged his passion and unique brand platform, seeking to make a meaningful impact on communities in need. In 1985, with the help of many of the top fashion models in the world, Kenneth launched the first HIV/AIDS public service campaign, years before our then president even acknowledged the disease. He then joined AMFAR's board of directors in 1987, and on World AIDS Day in 2004 assumed the chair, leading the organization for 14 years. Under his leadership, AMFAR, or the Foundation for AIDS Research, was instrumental in making significant breakthroughs in AIDS research, treatment, and prevention that benefited millions globally. In 2016, Kenneth accepted an appointment as a UNAIDS International Goodwill Ambassador with the goal of helping to end AIDS as a public health crisis by 2030. This year, in a shift of focus, Kenneth officially launched the Mental Health Coalition, of which Mental Health America and 24 other organizations are part. This is an unprecedented coalition of the most respected mental health service providers, leading academics, and influential creative and media organizations. The Mental Health Coalition was launched with an innovative digital storytelling platform called How Are You Really?, which creates a safe social space for individuals to share their stories. Join me in welcoming Kenneth Cole.
Thank you, Paul, and thank you for putting on this conference. Thank you for what you do. I congratulate Mental Health, the National Mental Health Association, for its leadership right now. It's at such an uncertain time of such high anxiety for so many.
It really is. I mean, this year has been so incredibly challenging, and we've already talked during the early stage of this conference about the impacts of COVID-19 and then the racial inequalities or inequities that have been brought to the surface in recent months and the general state of the world and how people are coping. I wonder if you mind me asking, just to start off the conversation, how are you doing and how's your family doing?
So this has been, a defining moment in our lives, as I am sure it is of everybody everywhere. And we've done a lot of reflecting. I've done that, I think, which in some ways is a gift. I've gotten to spend time with my family, which maybe I would not have been able to do otherwise. But truthfully, I find I've been in a perpetual fog for months now. I mean, as much as I try to focus, and one day tends to lead into another. My daughter asked me if today was Wednesday, and I asked her, well, is it this week or last week? So, and I think we're just all trying to process what all this means, and this notion of self-isolating, and is something we're just, as individually, none of us are accustomed to it. And what impact will it have? Can it have? I read a study recently, Paul, of that was done after SARS, and where certain individuals were quarantined, and it wasn't to the extent they are now, and certainly for as long as they are now. And a third of those came through with symptoms of depression, and a third with symptoms of PTSD. So this is a very concerning moment, and I think that this conference is, I think, at an opportune time, and I think anything that any of us can do right now to lend a hand or an ear, or put ourselves out there, I think is vital.
Yeah, I was talking earlier with Josh Gordon, who, as you know, heads NIMH, about loneliness and isolation and what we're seeing at Mental Health America too. It's not just in the stories, but the data, and as you said, the extraordinary number of people whose lives are not just disrupted by this, but who are in that fog. I mean, that fog of isolation and the anxiety that's developed for a lot of people from that. It's a big deal, not going to be easy to overcome this, is it?
It's not. I think it's the uncertainty that's the hardest part. And I think uncertainty just fosters anxiety because you don't know what's around the corner and you don't know what's at the other end, what the other end of this will be. And we don't even know when it will be or, um, and, uh, and then what will it be for people that we love and people in our lives? And what it'll be for me personally, what it'll be for me professionally. There's a lot everybody's balancing right now and digesting.
Yeah, and when we think about that uncertainty, there's uncertainty about, am I going to get sick? Is a family member going to get sick? Are they going to recover well if they do? I mean, all those kinds of questions. And there, as you've mentioned, also these questions that people are asking of themselves professionally. I mean, what does it mean for my work? What does it mean for my employer? What does it mean for my business? What about your business? I mean, how have you adjusted to this environment? This can't be easy.
Look, I've always believed that, I built my business on a platform of change. The fashion industry inherently is that, we have to be relevant at the moment of the moment. And relevant is a relative expression. And what's relevant and or what's fashionable to you today may not be to me, and what may be to you today may not be tomorrow. So it's a little easier in that regard because we're used to adjusting and adapting. And so um, we're we're right now we're encouraging people to work wherever they are and be as productive as they can to be in ways that they can under the circumstances that they are within which they are existing, and we're trying to be supportive and understanding, and I do believe at the end, what will come will be better somehow. We'll be more efficient. We'll find and create efficiencies and economies and processes that maybe didn't exist before. But it's going to be, an extraordinary journey. And it's not. I mean, the businesses are closing, schools, the uncertainty with our schools, and everybody's impacted by that because we have kids, and it's not our kids. It's our associates' kids, or it's our grandchildren, or it's but and the uncertainty with that and the impact to kids, not just academically but socially and emotionally, is also dramatic, and that doesn't just affect them, it affects the whole family. So we're processing this and we're trying to figure it out. There's no clarity. Nobody has clarity. Nobody knows what this looks like. This isn't the road anybody's been down.
Yeah, or maybe it's a road that one group of people went down in the mid 1980s with the uncertainty, and I'm suggesting here that people who are at risk of developing AIDS and HIV positivity at the time faced similar kinds of uncertainties. It was hard to know who was going to get infected. It was hard to know what would come next. Was initially a death sentence for people. I mean, it just created for a smaller population that I think many people didn't relate to at the time. This same kind of stress, anxiety, uncertainty, you actually took it on right at the beginning. What motivated you to do that?
I believe that here was the opportunity to talk about something that there was this dark looming cloud that existed over all of us, and few would address it. And I felt here was an opportunity to talk about something that was on everybody's mind, but not on their lips. And it was an opportune moment to say something that was important. And ultimately, the fact that people were reluctant to talk about it was the issue, because that's what fosters stigma, and so all those people who were presumed to be at risk were were petrified, and they were afraid that they'd be judged, and they were afraid if people understood their circumstances that they would be diminished as a result. And so we did a campaign then that spoke about the fact that nobody was speaking about HIV. And uh, but the difference also, though, is we didn't know how to, very early on in this cycle of that pandemic, we didn't know how to cure it, but we knew how to contain it. And we knew who was at risk specifically. We had a pretty good sense of that, which we don't have here. And that's a big part of the difference. And uh, and and we did a campaign. I did one campaign early on, which spoke about the fact that we're all at risk. And then I did an ad in about 1990 with a picture, because we knew it was about safe sex and clean needles. So because it was intravenous drug users, and it was transmitted through sex, gay sex, more often initially. So we did an ad with a picture of a condom, and we said, unfortunately, shoes are not the only thing we encourage you to wear. But it was illegal to advertise condoms in those days, so we airbrushed off the words, and there was a concern that maybe it would be challenged, but it wasn't. And then at AmFAR, we started the first needle exchange program. So, but there was steps that were constructive steps that were able to be taken with a clear sense of facts and knowledge and data / science that would take us in the direction that would make hopefully a meaningful impact.
Well, I mean, yeah, it feels like there's more science around the pandemic than public officials acknowledge. And in some respects, I do think there are some parallels. Maybe you disagree with this, between kind of what we saw, at the policy, the highest levels of public officials in the 1980s. I mean, I was in the state legislature in Connecticut at that time, trying to advocate. I was public health chair, so trying to advocate for people who are at risk of HIV infection and developing AIDS, and was dealing with, public officials at that level, who thought mosquitoes would transmit it, who thought that, they shouldn't go into restaurants and eat because it's going to be in the silverware and the spoons. And yet it took a while. I mean, I have to say, it actually took a couple of years, maybe even more, before we kind of cut through that kind of weird noise about that. And it feels sort of like the same thing's happening here. We know that masks, will do a lot. We know that physical distancing will help us a lot, but we still got that not so much background. We've got that foreground noise going on from public officials and leaders who are simply denying reality and denying facts.
Paul, we went through a cycle with HIV early on, where everybody was fearful of everything and each other. And then when it was clear how it was transmitted, then they almost became oblivious to it if they were not in an at-risk population. And we did a campaign in 2004, at the same time I assumed the chairmanship of AmFAR, which was that we all have AIDS. The goal was to try to create a sense of urgency for everybody, not just those who were specifically affected, because the notion was, if anyone is infected, we're all affected. And if it exists anywhere, essentially it exists everywhere, which is no more true, by the way, than it is than mental health. But and that also is a parallel here, because it has such extraordinary impacts on the whole community. When I started learning about mental health, mental illness, and then a year and a half or so ago, maybe 2 years ago initially, from my daughter, who was kind of driving the discussion, it was clear that 1 in 5 people domestically, 1 in 4 people globally, apparently we're going to live with mental health conditions. You know this, Paul, better than I do. And then, but I, in my heart, knew 1 in 200 people are living with HIV, and HIV affects everyone everywhere. I mean, so we then, and I believe that it's not 1 in 4. I think it's 4 in 4. I think everybody, if it's not you, it's somebody you love or somebody in your family, in your community, or in the workplace, but we're all living with mental health conditions. And 2/3 of those are doing so in the shadows, because they don't know how to address that and how to do it in a way that's not going to diminish them further, and that will move them and enable them and help hopefully heal them. So in some ways, there's similarity, but it's magnified, I feel, quantifiably today. And I do think this is a pandemic of massive proportions, and I think it's so much bigger than this virus that we're living through, than the physical virus. And there is so many more people that are going to feel the trauma for this for so many years.
Yeah, I agree. You know, again, we've seen it in our data, and I know that the CDC and the U.S. Census Bureau have done their surveys over the course of the last few months and have confirmed what we were seeing from the first week of the pandemic, which was this rapid increase in the number of people who are affected with anxiety, with depression, even the numbers of people who are experiencing symptoms of psychosis who never had before, you know, that we're seeing certainly in our own populations who are coming to us for help and services is really astonishing. And you're right. I think this one has, you know, far from the 1 in 200 or the 1 in 5 or the 1 in 4. I mean, this is about the 5 in 5. I mean, this is one of those times when I think everybody is feeling at risk. And as a result, everybody, you know, is worried. You know, everybody is experiencing this uncertainty. And so everybody is at risk of having those worries transform to anxiety, depression, psychosis, or more post-traumatic stress and others. So I think you've
The other
nailed
thing
it.
too, I was reading recently that the impacts of COVID, I think 32% of the population were admitted feeling symptoms or were suffering from mental health and or substance abuse issues in June and that or March, and that statistic now in July was up to 53%. So it is so even if it's not a mental health issue as you know it, it is a very defining consequences. And then also they're saying that if it's not, it's affecting everybody, not just mentally, but also physically. So these are moments that we just have to kind of reflect and try to get our arms around and understand what this all entails and where it's taking us.
Yeah, and you mentioned that some of the push for you toward taking this on as an issue and building that coalition came from your daughter. I'm going to assume your daughter is significantly younger than you are and that I am, and just make a comment that one of the things that we're seeing, and we've seen historically, we've seen before the pandemic, was the effect on young people of anxiety, depression, worry. I mean, we've absolutely seen a deeper impact in the pandemic on younger people, but you know, we've all used the statistic, and others will use it. We'll use it throughout this conference that, you know, half of mental illnesses emerged by the age of 14 and 3/4 by the age of 25. Was it in part because what your daughter saw and or experienced that kind of gave her the energy to say to you, maybe this is the next big issue to take on? Or was
But I
it
think
something
it
else?
was one that she was taking on and she believed in, and another daughter did as well. You know, it's something that's also I also observed, and you know, whereas HIV had it spoke to a very specific demographic of the at-risk community was very defined early on in the process. With what's so unique here is, to your point, it's not just old and young; it's black and white, it's Jewish and Christian and Muslim, and it's tall and short, and maybe most important by here is Democrat and Republican. So it is a nonpartisan issue that affects everybody. So it's a very important moment, and I'm anxious to see if this is something that everybody can come together on, because there's not much that they do today, and because they need to, and the impacts of this. Although a lot of it is maybe is rooted in some science, but not as much as in the physical virus. If we don't, uh, I don't think we'll even have the capacity conceivably to deal with it eventually.
Yeah, I would agree. I think to those points, the ability to come together around this certainly is there. And it always has been in some ways, but the truth of the matter is that in the states, and the states have been responsible for a lot of the support and the funding of behavioral health services in the past, just the way the states and the federal government divided up the roles around healthcare, we were generally, last ones in, first ones out. So the last economic collapse or catastrophe that we had in between 2008 and 2013, states actually cut more than $4 billion from mental health budgets at the time, and had not fully restored that money when this hit. And so the natural response of public officials has often been to think of us last, but to take away our money first. And I'm hopeful that this time it is going to be a little different, because I think people do recognize it's affecting everybody and in very real ways. And it used to be that they could say, well, we have to focus on serious mental illness. Well, we have to take all mental illnesses, all mental health conditions seriously. And that opens the doors and opens our eyes to just how big an issue this is, which, as you say, isn't going to go away if we don't do something about it.
Yeah, and like, as we say, we think everybody has mental health, and we all have a deal with it and need to address it individually, and most of whom are very highly functioning individuals. So and it's not as recognizable to some people as of absent of engaging and making that at some level of effort to do so.
Yeah, and I think that the fact that it isn't as visible as some other, health conditions, I think has allowed people to neglect it and to not think about it. I think, again, from a policy perspective, but I just have to believe, from what I can tell, when I share my story, about my son and his mental health issues, and, my own story about, sort of different kinds of mental health issues, people tend to share their stories too. And one of the things that I really like about the Mental Health Coalition that you've created is that a lot of the energy is built around stories. And so would you talk a little bit about that, about the importance of the narratives, the importance of the stories in normalizing this, and why that in particular has become a focus of the Mental Health Coalition?
Well, we launched it with a storytelling platform that was created by my other daughter, Katie Cole, actually. And there's the and it's called, and what it does is it sets out to answer the single most asked question everywhere in the world, every day of the week, in almost every language, and the one most rarely answered, which is, how are you really? And so the goal was to engage people, encourage people to be vulnerable and express themselves in ways they might not ordinarily, in a platform that's safe, but amongst others that have made that leap of faith. And what happens is that, and there's so much anecdotal evidence and science that supports this, is that it helps people. It truly helps people, and and it helps not just that individual who's telling a story, but it also helps those who can relate to that story and engage with the story. So the goal of the platform, anyways, you log on, and it's howareyourreally.org. And then we have available, you can exchange, you can engage with other people's content, or you can set up your own platform, and you can be anywhere from vulnerable to empathetic, or anywhere in between. And then you'll hopefully update your story, as your circumstances and time goes on. But it's a helpful tool, we find, and we're working on other mechanisms. The goal, you should know, is to destigmatize mental health, to rebrand it. And I'll take you back just a little bit to give you kind of from inception. So I was talking to people at NAMI, and they had asked if I would take on the project of a to destigmatize mental health, and only because it's so overwhelming, and there isn't a safe narrative that one can access. I asked 5 therapists for a definition of depression, and I got 5 different answers. So, so you can imagine how it is for an individual to talk about, themselves and their circumstances. So we said, all right, so if we say we're going to work to ultimately change culture is what it is, but if we're going to come up with a new narrative and to rebrand mental health, make it non-threatening, make people, enable a place where people be comfortable discussing their circumstances, would you support it? And they said, we're all in. And then I went to, initially a dozen other providers, some of the biggest in the country, and including your organization. And we basically asked the same question, including, by the way, Crisis Text Line and Child Mind Institute and the JET Foundation and National Alliance for Mental Health. That's NAMI and National Council of Behavioral Health. So every one of them said, we're all in, which was wonderfully flattering. But it was, everybody recognized the need to address this stigma because it was just in and of itself so debilitating. And also recognizing, as I said, that 2/3 of those suffering are do it in the shadows. So we set out to and we engaged also some creative groups, people at Pentagram, who are great branding agency, agreed to do this pro bono. And so we set out now to rebrand and to destigmatize mental health. So the first effort was this storytelling platform. And we're working on a few other initiatives, which we're going to be launching shortly, that will be other resources that people can access. But the biggest opportunity here is the ability is aggregation, because you've got all these extraordinary organizations that do great work, and often they're the best kept secrets because they don't have an ability to get that out there, to marry needs to resources in effect. So our hope is that we create one platform, and you go to mentalhealthcoalition.org, and we aggregate the best of what's there throughout all of our partners now. And there's 25 partners, and plus there's all these other organizations we're affiliated with. And we're affiliating with. So, and then the ability to, to access and to digest and avail oneself of some of the best minds, the best thinking in the space, is extraordinary. So, and 1 + 1 is unquestionably more than 2, especially in this space. And coming at it from a business mind, from business space. There are redundant resources that ultimately become made efficient by nature of the visibility and transparency. And then there's a void, and there's opportunities that become equally more transparent, or equally transparent. So the goal is to shine a light on all this great work out there, and that's what we try to do, and to magnify it and amplify it to the best of our ability, and that's what. And we're all very excited about a storytelling platform to engage people, and we launched that on May 15th with Kendall Jenner and her sister Kim Kardashian. It's a very high-profile, well-networked individuals who were anxious to tell their story, and we had 200 million views the first 48 hours, I think.
Yeah, I think that's worth underscoring. 200 million views in the first.
But but today, when I did my campaign about We All Have AIDS, We All Have AIDS, is I flew with Mark Seliger down to South Africa, and we photographed Nelson Mandela, and then we flew to LA and photographed Elizabeth Taylor and Elton John, and we also in South Africa we photographed Desmond Tutu and Zaki Ahmed, and we had all these individuals who were such heroes. And such articulate voices in the struggle, HIV struggle, but they were all doing it in silos. So the goal was to bring everybody together on one stage. But in 2004, we reached maybe a couple 100 million people over many, many months. The ability to reach so far, so fast, so efficiently today, but is enabled through social media, is very encouraging, because if you get everybody aligned and you aggregate all the best thinking and the best science and the best, and you identify the best resources, you can make a meaningful impact in the past you never could have, and today in ways you couldn't otherwise.
Yeah, no, that's exactly right. And I mean, we've discovered it ourselves just with this particular conference where we're having 10 times the number of people participating as would be able to participate in our in-person conference that we had expected to be holding, a
Right.
couple of months ago or during this
Perfect
time.
example.
Yeah, so and I think that makes a big difference because in getting these stories out there and having people, even with, celebrity status say, me too, this is about me too, it's about my family, it's about issues that I face, it's about issues I'm concerned about, people I'm concerned about. I remember, the time of that AIDS effort, it was a little controversial because, everybody's, basically owning this, and some people didn't get it, sort of didn't get what the point was. This one I think is just a little easier because I think people get the point of this because in fact, we all do own this one, and we all do own the responses to it, and I agree. I mean, I think one of the things that's happened both through the coalition and certainly in my 6 years when I came to MHA, I inherited a legacy of advocacy organizations and guilds who really didn't get along with one another very well at all. We each had little pieces of work that we did, and people were very nervous about other people getting into their space. And I think in the last few years, certainly all the leaders with whom I've worked have figured out that collectively we're so much stronger than we were when we were 1+1+1+1+1+1.
Right.
The group is much bigger. So
Yeah,
yeah,
you guys have done this actually remarkably, and what long before we did, and there's so much that we've learned, and so much more we still have to learn from what you've done. But I think you've brought together 200 affiliate organizations or something, which is remarkable and a testament to MHA and to yourself. So congratulations in that regard.
well, no, thank you for that. And I know our time here is actually running very short, so maybe I just want to give you, one additional, shot at just, is there something you want to just communicate to the people who are watching us here today that we haven't had a chance to cover here? And let me just.
Well, yeah, I would urge you to selfishly engage with us on social media, either Instagram and Twitter, and also and open yourself up and kind of engage with the content and allow yourself to be vulnerable. I did it truthfully. You can see my story, it was something I had never done before, and it was so therapeutic, I have to tell you. So, but I encourage you to do that. But I also, I mean, these are crazy, trying times, and I think there is no normal, and we just have to be open to what's around the corner, and we have to listen a lot better, and we have to be much less judgmental, and I think that and we'll get through it together if we just kind of we want to, and we're patient, and also with HIV, there was an action people needed to take is they had to wear a condom, but it was interesting how it was easier to get people to protect themselves, knowing the science supported it. Today we have to wear a mask, so it's a lot easier to wear a mask today than it was to wear a condom then. So there are things we can do, and we can protect ourselves physically, but we can also protect ourselves emotionally, and we're not well unless we're well physically and mentally. I mean, the two need to work in harmony with each other, or neither accomplish what we need to see done.
Well, Kenneth, thank you so much for this. I mean, the power of your platform is immense, and you're using it to bring so many forces together. That's making a huge impact, and will continue to. I do want to encourage people to visit that website for the coalition. Take a look at what's there. share their stories on that website. And
The website's actually, the mental, is howareyourreally.org is a separate website for the storytelling. And then, but either one of them you can engage with on social media, Mental Health Coalition or howareyourreally.org. And engage with it, be part of it, bring your community to it. And we're so much stronger together than we are independently.
Well, thank you. Looking forward to working together in the weeks, months, and years to come.
And congratulations, Paul, on this conference, which is extraordinary, which you guys did on relatively short notice, and on all the great work that you're doing personally and collectively. Thank you.
Thank you, Kenneth. Appreciate it. We'll be right back.